A seizure is a brief episode of abnormal electrical activity in the nerve cells of the brain, which may or may not lead to a convulsion. A convulsion is a more severe seizure characterized by involuntary spasmodic contractions of any or all voluntary muscles throughout the body, including skeletal, facial, and ocular muscles. Antiepileptic drugs are called anticonvulsants. Antiepileptic drugs is a more appropriate term because many of these medications are indicated for the management of all types of epilepsy, not necessarily just convulsions. Anticonvulsants are medications that are used to prevent the convulsive seizure typically associated with epilepsy. The goal of anti-epileptic drug therapy is to control or prevent seizures while maintaining a reasonable quality of life. Many anti-epileptic drugs have adverse effects, and achieving seizure control while avoiding adverse effects is often a difficult balancing act. In most cases, the therapeutic goal is not to eliminate seizure activity, but rather to maximally reduce the incidence of seizures while minimizing drug-induced toxicity. Many patients must take these drugs for their entire lives. Treatment may eventually be stopped in some, but others will experience repeated seizures if constant levels of anti-epileptic drugs are not maintained in the blood. Abrupt discontinuation of these drugs can result in withdrawal seizures. A number of anti-epileptic drugs are available. Sometimes a combination of drugs must be given to control the disorder. Nonetheless, most seizure disorders can be controlled. To optimize drug selection for each patient, neurologists consider the known efficacy of a given drug for a certain type of seizure, the adverse effects profile, the likelihood of drug interactions, the cost, and the ease of use. Generally, single drug therapy must fail before two-drug or multi-drug therapy is attempted. Patients are normally started on a single anti-epileptic drug, and dosage is slowly increased until the seizures are controlled or until clinical toxicity occurs. If the first anti-epileptic drug is not effective, the drug should be tapered slowly while a second drug is introduced. Anti-epileptic drugs should never be stopped abruptly unless a severe adverse effects occur. It is sometimes difficult to control a patient's seizures using a single drug, but monotherapy is most likely to result in higher serum drug concentrations, fewer side effects, and better control. Therapeutic drug monitoring of a serum drug concentration provides a useful guideline in assessing the effectiveness of therapy. Maintaining serum drug levels within therapeutic ranges helps not only to control seizures, but also to reduce adverse effects. Each patient should be monitored individually and the dosages adjusted based on the individual case. In many patients, maintenance is successful at levels below or above the usual therapeutic range. The goal should be to slowly titrate to the lowest effective serum drug level that controls seizure disorders. This reduces the risk of adverse drug effects and drug interactions. Successful control of seizure disorders hinges on the selection of appropriate drug class and duration. As with many classes of drugs, the exact mechanism of action of the anti-epileptic drugs is not known with certainty. However, strong evidence indicates that they alter the movement of sodium, potassium, calcium, and magnesium ions. The changes in the movement of these ions induced by anti-epileptics results in more stabilized and less excitable cell membranes. The major pharmacologic effects of anti-epileptics are threefold. First, they increase the threshold of activity in the brain called the motor cortex. In other words, they make it more difficult for a nerve to be excited or they reduce the nerve's response to incoming electrical or chemical stimulation. Second, they act to limit the spread of a seizure discharge from its origin. They do this by suppressing the transmission of impulses from one nerve to the next. Third, they can decrease the spread of nerve impulse conduction within a given neuron. Regardless of the mechanism, the overall effect is that antiepileptics stabilize neurons and keep them from becoming hyperexcited and generating excessive nerve impulses to adjacent neurons. Some work by enhancing the effects of the inhibitory neurotransmitter gamma aminobutyric acid, better known as gamma. The major therapeutic use of anti-epileptic drugs is the prevention or control of seizure activity. Anti-epileptics are chiefly used for the long-term maintenance of epilepsy. However, they are useful for the acute treatment of convulsions and status epilepticus. In these cases, the therapy is typically diazepam, which is considered by many to be the drug of choice. Once status epilepticus is controlled, long-term drug therapy is begun with drugs from the prevention of future seizures. Patients who undergo brain surgery or who have experienced severe head injuries may receive prophylactic anti-epileptic therapy. These patients are at high risk for acquiring a seizure disorder, and often severe complications will arise if seizures are not controlled. Anti-epileptic drugs are plagued by many adverse effects which often limit their usefulness. Drugs must be withdrawn from many patients because of some of these effects. In December 2008, the U.S. Food and Drug Administration required black box warnings on all anti-epileptic drugs regarding the risk for suicidal thoughts and behavior. Patients being treated with anti-epileptic drugs for any indication should be monitored for the emergence or worsening of depression, suicidal thoughts or behavior, or any unusual changes in mood or behavior. This slide lists the major classifications of anti-epileptic drugs with examples of drugs in each category.